Welcome, everyone. I hope you've brought your stethoscopes and your tongue depressors and your doctor guns, because every doctor has a good gun. A good doctor does, anyway, because we're going to be discussing Dr. House, the doctor, if you will. Not the doctor from that stupid British show that I don't care for. This is the American doctor, who's also played by a British guy. It's a whole mess. We'll get into it. I'm, of course, going to be joined by Brian Vaughn. Brian, welcome to House Part 1.
I don't have any time for introductions. I'm a sarcastic professional, and I'm going to tell it like it is.
That sounds about like you. I could get behind
Yeah.
that. Are you a sarcastic professional, Spencer?
No, I'm going to be playing the straight man today.
Oh.
I'm going to agree with everyone's medical synopsis.
Who's good cop and who's bad cop?
Everyone's medical diagnosis.
Oh, there you go.
Medical synopsis.
Yeah, I had to correct that.
We kind of wrote about what it was, but we don't really have a definitive answer for you.
Yeah,
it's just a
we've got a general idea.
Well, gentlemen, I guess see no other way than to just kind of dive right into this. Let's start talking about the show House. Have either of you watched much House in your lifetimes?
I hadn't watched a single one until this.
I also was wholly unfamiliar with House until watching these episodes. I don't know how. I think anybody existing in this millennium, you get a little bit of knowledge by osmosis of shows, so I knew a little bit about it, and I definitely could picture some of the characters. I knew Hugh Laurie's shtick, how he spoke, how he limped, but I had not ever seen an episode.
And it's something that I have probably seen. I've seen all but the final season. I can confidently say that because I know I pirated every season at one point or another and watched all of them. This was a show that
they're going to come
years,
lock you up.
Oh, no. It's going to be Lars Ulrich coming after me again. Again, like it's happened before. You know that, Lars.
He's always showing up at the door. Hey, man, I was just wondering if you could pay back all the money from all the Metallica songs. Your total's going to be 17 cents.
Yeah!
Ooh, yeah!
So House was something that people all my life have been like, hey, Van, you're kind of an asshole and you don't really tolerate much, so maybe you'll like House. It's something you should love.
And plus, you're a doctor.
And you're a doctor. This was
British
in medical school. Also, you're British. Look at you walk with that limp, which is probably the closest trait I have to him. So I was told to watch it for years, never got around to it. My ex-girlfriend kind of introduced me to it, and I fell in love with it. It's my guilty pleasure. I fully admit that it's not phenomenal by any stretch of the means. There's some good things about it.
It is easy to watch, though.
Very easy to watch.
They suck you in so fast to where you kind of can't stop, even though you want to.
And that's kind of what I've done. Now, you said something like that happened to you.
It did. I was watching on Peacock, and the second episode that we will be discussing later on in the week was on. That one finished, and I'm lazy. I was on the couch, so I was just kind of like, I don't want to move yet. So then the opener, the cold open, and the next episode came out, and I was like, well, now I can't stop now. I've got to figure out what happens here. Since we're not going to be discussing this, I'll just tell you, it's a fitness lady. You've probably seen this one. She's a fitness lady, and she's running up the bleachers,
out, right? Okay.
with an overweight guy that she's trying to train. The big thing is you think he's gonna, because they pan on him, they close up on him, and he looks like he's going to have a heart attack, and then it's her that passes out. So I was like, what's going on here?
Subverting expectations.
Yeah, what are we doing with this? So then,
was it a bacterial malady or something like that?
It turns out that she was a liar, and she'd gotten
it was an STD.
No. She had gotten the stomach operation. What's that called again?
Oh,
with the gastric bypass or whatever.
Yeah.
She'd gotten that, and her body actually was more comfortable on the inside, being a bigger person and eating that kind of food is what they ended up deciding. But since she was thin, she actually wasn't eating the same way, and her body kind of shut down on it. So in the end, she chooses to be thin and risk her health, because that's the only way she can live. But it takes the entire episode to do that. So I just kept watching, like, well, I'll just watch the next scene, just the next scene. So the writing does just hook you in like that, to where once you start, it's like, well, I gotta see what goes on here.
Lots of plot propulsion.
Yeah.
I'm gonna go out on a limb and say that in that episode, House was mean to somebody.
He was mean to everybody.
Oh, okay.
I bet he was. I bet he had some one-liners too, some wisecrackers.
If people come up to you and they're like, "Did you see the episode of House where House was ultra mean to this person?" No, that's every episode. Did you see
the one where he was nice?
Okay,
that would be
he hugged
weird.
his patient.
You pretty much covered what House is.
Yeah.
It gives you a malady of the week, an issue of the week, some problem that House has to solve. And the show was very much based on like Sherlock Holmes. In fact, his nemesis in one episode, It's literally called Moriarty.
Wow.
Yeah, they didn't telegraph that at all. House is actually our second straight Fox show having run on that network. It ran for 8 seasons from 2004 to 2012. It has executive producers David Shore, Paul Atanasio, and Katie Jacobs, and they pitched the show as a hospital version of the CSI-style whodunit, in which doctors investigated symptoms and causes. Fox did buy the premise, but then President Gail Berman told the creative team, I want a medical show, but I really don't want to see white coats going down the hallway. Because that was obviously a massive trope at the time for hospital shows, and also something that they do frequently in-house. Maybe they didn't do it as much in the first
I was
season,
going to say,
remember.
it's definitely still present if they were not wanting that.
Yeah, absolutely. Now, the working title of the show was, at the time, Chasing Zebras, Circling the Drain.
I think I like that better, actually. There's a lot going on, but you wouldn't forget it.
Well, a zebra is apparently a medical term for something you can't figure out. So that makes sense in the medical community. It sounds real stupid.
In the end, they're like, let's see, what's the doctor's name? Well, a couple of monosyllabic names. And then what's the most common word you could think of? House.
Zebra.
Yeah, the zebra would have been fun.
Dr. Zebra, what are you doing? It's a zebra.
Ooh! More excuses for horse noises on the podcast.
Which do zebras make a noise like that?
I don't know, to be
Surely
honest.
they
I'm
do,
assuming
right?
so.
Because aren't they? They've got to be some kind of
Here's
horse.
what we're gonna do is,
But like donkeys make different noises.
They bray.
in the post process here, you're gonna look up the zebra noise and
I'll
you're
put
gonna
it
put
in
it in right here.
Okay.
So we all find out what a
We
zebra
need to
sounds
know
like.
in real time
I'll do
with
it.
the listeners.
Editor's note, zebras sure do make noises, and they bark, and they make like donkey sounds, and then this noise.
As the concept progressed, it was decided to have one central figure on the show to base the show around as opposed to solely a team show like they originally planned. The producers wanted a, and I quote, quintessential American personality for the lead role of House. And at the time, Hugh Laurie was filming Flight of the Phoenix in Namibia. He submitted an audition tape filmed in a dirty bathroom because it was the only place he could find light to do it. And he improvised an umbrella for the cane. Now, Bryan Singer, who has spent his career sexually assaulting women and getting away with it, at the time was attached to the show and, in fact, directed multiple early episodes. He saw Laurie's original audition video and didn't even know he was an American because he was so convinced by the accent, which very clearly is not an American accent. It's kind of in the ballpark, but
It's not
I couldn't
It's not
really
great.
tell
It's
he
not
was
terrible.
British. Yeah, I thought it was fine.
he lisps a little bit. That's how he makes it Americanized. If you hear him speak, he doesn't ever lisp, but he does his House.
And
It's
there
kinda
are
weird.
like slight. I wish I would have. I didn't get these in my notes, but there were a couple of times where he says a word not like a human,
Yeah,
just only because I think he's trying to avoid
Yeah,
going to his native
be.
the
accent.
pip accent.
Yeah. Yes, as it's technically called, the pip accent.
That's right. Now, the other actors of import here are Lisa Edelstein as Dr. Cuddy. She's the Dean of Medicine at Princeton Plainsboro Teaching Hospital, which is where most of the show takes place.
Apparently in New Jersey.
In New Jersey. It's not a real hospital, but there is a very similar hospital
Yeah,
there.
should have been a lot of people talking like this throughout this whole episode.
They have those periodically. Edelstein has had a very solid career. She's had parts in Ally McBeal, The Practice, and had a starring role right after House in something called Girlfriend's Guide to Divorce, which
Oh,
is
of course.
highly rated. Did you hear this?
No, I haven't.
Okay.
I have seen her in something, but I couldn't figure out what it was. Her face is very familiar to
I
me.
have seen her in The Practice, which I watched with my mom and sister as a kid.
She was a debutante of the 1980s New York era stuff. Like she was in nightclubs. She was very well known at that time, and she's had a pretty reasonable career. And she actually authored, composed, and performed the musical Positive Me, which is one of the earliest AIDS-related theater productions, which Rent, stuff like that.
Yeah.
So she did that. Jesse Spencer plays our Australian tiny hunk, Dr. Robert Chase, who's one of House's main underlings for the first 3 seasons of the show, although he does stick around for most of the series run in various roles. He has not done a ton of stuff outside of House. He's mostly had one-off roles in various television shows, including the voice of Shuji's father in some anime which was called She, the Ultimate Weapon.
Probably pretty awesome.
Sounds pretty cool.
It's worth a shot, I'm sure.
We already know Xena's the ultimate weapon, though. So
Yeah, we've established that in both our lore and, it's just true.
Yeah, exactly. Next up, Robert Sean Leonard plays Dr. James Wilston, which is House's only real friend, the kind of bucktooth guy that he talks to in a few of these episodes. Wilson is the head of the oncology department at the hospital, And Leonard has been in some big things, Dead Poets Society in
Oh.
particular, as well as a bunch of minor roles in primetime TV dramas, this kind of thing. Omar Epps plays one of the few characters in the show throughout its full duration, Dr. Eric Foreman. Foreman, early on, is one of House's subordinates in the early years, and particularly this first episode we're going to talk about. He's been in a ton of stuff as well, including something called Dracula 2000. Sounds super cool.
Yeah, it does.
And then more recently, This Is Us, that drama. I think we mentioned on the show before.
We
He's
have
in that.
mentioned it because there was another actor, I believe, that was
in
in it that we discussed at some point or another. At some point, we'll probably have to cover that show because none of us know what it is.
No.
I just know it's supposed to be super sad. Everyone cries at it
Yeah,
all
it's
the
a
time.
big-time melodrama of some sort.
And finally, our last of the regular early season crew is Jennifer Morrison. She plays Dr. Allison Cameron, who is another house lackey. She is also in This Is Us alongside Omar Epps and has had roles in How I Met Your Mother, and she had a starring role in Once Upon a Time as something Gray or Sky. I don't know. I didn't watch it, but the main character, I guess. Now, House was immensely successful, and in 2008 was the most watched show internationally, with over 80 million viewers that year across the globe. So
Wow.
this was probably our most successful show overall. Xena was syndication. This one is, well, I guess it depends on how well
It's
the
a
21
network
Jump Street
drama.
stuff.
Yeah, those are going to
transferred.
be oftentimes your very most successful shows. The ones that really take
wide-reaching
off.
anyway, yeah. Like, we get the most,
'Cause
the
it's-
most casual of audience members watching
Yeah,
it.
it's easy to see how you could be 13 and watching a House episode and stick through to the end, or how you could be
Yeah, I was gonna
83
say
and
that.
do the same.
Why would you be Olivia Wilde and watching this show? Because Olivia Wilde's character is called 13.
Yeah, that was well done.
And by the way, I only listed the main characters from this episode. House had
Yeah.
a big transition. At the end of season 3, most of his crew quit, which were Doctors Cameron, Foreman, and Chase. They left or did other things. Some stayed on the show in smaller roles. Some just left the show for a bit. So he essentially has to pick a new team. So he gets a team of 30 interns, essentially, and puts them through trials and tribulations.
I bet he's
and
real kind
eliminates
about
them.
it.
Oh, he's great. He's super
Very
sweet.
understanding when mistakes are
Walks
made.
them along, yeah.
Yeah.
No, and the new crew comes from that group. There's Dr. Tao, 13, others who we'll discuss when we get to the episode later in the week. So let's get right into this episode. It starts rather abruptly with Lisa Cuddy, Dean of Medicine, telling House he has to teach some diagnostics doctor class because would you believe it? Even doctors get sick, and the regular professor is spewing everywhere, in House's words.
That's the technical term.
The doctor term.
Yeah.
He's a doctor, much like me. Now, she gives him an offer. You can skip 2 hours of clinic duty if you teach this class. To briefly explain that, all the doctors at this hospital do their normal doctor job, but each week you have to do, I think, 10 hours of free clinic duty. So these are the people who don't have insurance coming in and being taken care of. Each doctor dedicates
Right.
a certain amount of time to it. House hates it.
Well,
Hates
yeah,
it.
because in America, if someone doesn't have health insurance, you're just
They're
supposed to
scum.
kill them,
They're
right?
scum. Yeah.
Exactly. Just bury them in the yard.
Yeah, and just hope they never recover.
So he's being offered 2 hours off of clinic duty if he'll teach the class. He says he won't do it. He storms out of her office. He then stops a few feet out of the door and begrudgingly comes back in to say, you know, you're supposed to chase me. And then we negotiate. I went 4 hours off of clinic duty. Cuddy says, no way in hell. I know you will do anything to get out of clinic duty, so it's 2 hours of nothing. House relents and he says, okay, I'll do it. Having been utterly defeated, he hobbles his way off to presumably be mean to someone.
Which, by the way, I knew the limp was a factor, but in this part, this is my first introduction to how exaggerated it is.
It's
it was
over
like,
the
He's
Whoa.
about to fall over on his side with every step he takes.
I knew he had the limp, but when I saw that scene, I had to make a note. Really exaggerated limp here. So he doesn't hide that at all.
No, not at all. And early season episodes, this is season 1, episode 21, I think, they hinted at the leg, like what happened.
So this is the one where you find that out then. This is the first time it gets into that.
You just spoiled it for everyone.
I'm asking. Like, I didn't
Yeah.
know how much they went into that before.
Yeah, this is the
one.
first one you really
Okay.
find anything out. So this
So
is
this is
a big deal.
Yeah.
But it is like a reveal that's set up.
Yes.
Along the way.
That's interesting. Yeah, I had no idea how much of a secret they kept the backstory behind that.
But this is near the end of season 1.
It's the next to last episode. I believe. I think
Okay,
there were
so no
22.
wonder they're paying it off at this point. Was the show successful at this point already?
A little bit, not certainly to the degree it was a few years later, but at this point it had watchers. Like
They
was
probably
getting
knew they
eyes.
were getting renewed.
Mhm. Oh yeah, I
Yeah.
think there was a 2-season order early on, and then it was boom. Okay, you're going for a while.
Yeah.
Now a nurse says, "House, you've got a patient," and we hear a very soft voice say, "Greg," and House's expression sinks to the floor. Turns out it's his ex-girlfriend Stacy, who's played by actress Celia Ward, who is someone that doesn't look like anyone whose name Stacy should look like, in my opinion. I think of like a blonde ditz, and this woman is not a blonde ditz at all. She means business. She's a housewoman, which is kind of almost like a Ron Swanson woman.
A housewoman.
Yeah, you get it. Her new husband is dying, and they can't figure out why, so she's come to the one man who can solve the problem. We right away are led to understand that there's an awful lot that's gone on between these two, and House expositions that it's been a long 5 years since they last saw each other.
House also takes a moment here to be particularly mean to Stacy's husband and insult his manhood.
Not to someone so poorly endowed. This guy's pancreas is pathetic.
Everything comes to a head when, after being asked if he was busy, House says, "Oh, I'm not too busy to take the case. I just don't know if I want this guy to die or not."
Right. Yeah. So that's not a very generous doctor approach right there.
No, to me at this point, this signifies to me what I was already suspecting from their tense interaction, that there was a romantic past between these two characters. As someone who hadn't watched the show, I don't know how much this came up in the first 20 episodes of the show.
I don't think she was on the show prior to this. However,
Oh.
she was on many more episodes. She was
Okay.
not a recurring. Well, she was recurring, but she was not a regular cast.
So
member.
we're all being introduced to Stacy at this point.
I
Oh, I
believe
see,
so.
okay.
It might have been offhand we saw her, but I don't even think that's the case. I think this is the first time. we've seen
Why?
her.
I understand he's a vindictive asshole, but after 5 years, you still want your ex's significant other to die? That
Yeah.
seems a little bit harsh. That's
It's
petty.
right in the Dr. House wheelhouse.
Well,
And
I mean, he seems like one of those guys who could be wearing one of those graphic T-shirts that says like, "The only language I speak is sarcasm," or whatever. You know, he's always wanting to shit in someone's tea.
And
Essentially.
we often find out that, okay, maybe he does have a heart of gold and he'll
Yeah.
do the right thing, but he
Mm.
also doesn't.
He a lot of
A
times,
lot.
yeah.
And anyway, next up we see the theme intro music stuff, and it's largely unchanged throughout the duration of the show. It's
Yeah.
pretty boring as far as things
Yeah,
go.
it's. I had in my notes that it's bland, dusty electronic music.
I have that there's a slow piano riff, which tells you this show is as edgy as it is cool.
Yeah.
It's mostly just helicopter shots of the hospital and organs with
There's some
names inside of them.
rectangles.
Yeah, it's just a bunch of stuff. Not really that interesting. So we return from the intro to find House in a classroom full of medical nerds, and he's sitting silently on the stage staring at the floor. After an uncomfortable amount of silence, House finally asks, 3 guys walk into a clinic. Their legs hurt. So what's wrong with him? I don't know if he said guys, but 3 people walk into the clinic. After a young man probably named Evan Shipley, after looking at this guy, I'm not sure. He was obviously a doctoral student. He responds with an answer. House goes on to explain that this isn't just a random question. It's legit 3 different scenarios he's had firsthand experience with. This is, again, a diagnostics class. So this is right up House's alley.
Oh, yeah.
It's teaching people how to use critical thinking and figure out how to solve problems.
Just spitballing about possible maladies.
That's right. So we have 3 scenarios. The first one is person A. We have a farmer and one who presumably left his life at the farm eventually to go serve waffles to Leslie Knope, because this is, in fact, JJ
Yes,
from JJ's
Parks
Diner.
and Rec. Yes.
He says he was fixing a fence and he had tightness in his ankle and had loss of muscle control and fell. Person B.
Liar.
Liar! I wish they would do that, like those Ace Attorney.
Stamp it on the screen also. Lawyer.
Person B is a high school volleyball player, and at practice they dove to hit a ball and fell, with the coach assuming it was a pulled muscle. In the flashback, because again, this is a TV show, we'll see flashbacks, we see that it's also very much the same middle-aged man as the farmer. The students kind of go, come on, really?
Yeah, also the students proclaim, one woman in the audience or whatever, in the class says, "You expect us to believe there's a 40-year-old guy playing volleyball with high school girls," or something to that effect, which elicited to the reaction out of me, that guy's like 60.
Yeah, way older, exactly.
40, I mean, maybe it's just that 40 is approaching much faster than I care for it
You got a
to.
little defensive, didn't you?
I did. I was watching it alone and I felt defensive.
You were just mad, angry at your television. And then we have person C, who is Carmen Electra golfing.
Yes.
There you go, that's
I
that.
also, the hayseed man from the first scenario, I like that when the flashback shows him in the hospital, he still has straw sticking out
And
of
the
his mouth.
hat and
It's pretty good. I thought that was
suspenders.
legitimately funny.
Yeah, it's pretty interesting.
Because House is taking liberties with these flashback images, by the way.
Absolutely. One of the kids is excited that House treated the, quote, Baywatch chick.
Yeah, and also that's the nerd kid that looks like a childhood you. What's he doing saying Baywatch chick?
Yeah.
And then Baywatch also. I'm sorry, I'm about to derail this.
We'll have to do that on the show soon.
This show, yeah, we should. This show, House, started in 2004. This episode presumably took place then, 2004, 2005, because it's toward the end of the season. And Baywatch is getting a featured play here, a show that had been off the air for 3 years already at this point.
Did you look it up?
Yes.
Okay, I was getting ready to do the same.
It went off the air in 2001. Carmen Electra, was she still a household name? Because we would have been in college around this time. I feel like Carmen Electra already was someone that was very much not exactly in the public conversation. Seemed like a strange guest star, and I wondered what or why this happened.
I think she might have been, because there was also the sex tape stuff that came out later. So
Tommy Lee wasn't in the episode.
Unfortunately. I wish he were. More on musicians in House later. Anyway, it is a weird choice. Clearly, they could just book Carmen Electra, so they just did. And that's what we end up seeing.
I guess so, and we see her for a while.
House reveals he's just disguising the identity of his patients. So that's essentially the story behind these characters. In reality, we have JJ the farmer, a young girl volleyball player, and a middle-aged man, and all three are having leg trouble. House goes on to say that in less than 2 hours, one of the three will be tossed out of the hospital for chasing narcotics. One will be very close to death. And at this, we have kind of the structure of the way the show's going to go. House is going to explain all three cases to the class, weaving in and out of each story, and we as the viewer see flashbacks and visual examples, including the students being in the room with the patients talking through what they do, what they want to do. It's kind of loosely set up. It's better visually, but you get the idea here. House says, let's start with the farmer. He asks the students what they would do with the farmer, and they start spouting off a series of tests they should run, when House tells them they aren't doing the one fucking thing they absolutely should do first. Look at his leg. His leg hurts. Look at the damn leg.
It's the first time of many where House makes like some sort of buzzer noise with his mouth and says, sorry, the patient would already be dead. And I had some sort of flashback to my childhood of my own father making buzzer noises if I did things incorrectly. And it made me kind of want to kick House in the balls. I don't know.
Oh, Brian threw a gutter ball. Here's Charlie.
Yeah.
Yeah, exactly. We see in the flashback now, House has switched JJ for Carmen Electra, and there's a visual gag with House being super gross and ogling her. He looks at her leg and realizes we have a puncture.
Does he ever?
Boy, he gets right up on her.
Yeah.
Hugh Laurie just straight up utters the line, take off your pants, and then shoves his face basically in between Carmen Electra's legs to look at a bite. Or a puncture, as he says.
Yes, a puncture.
I mean, he is just, I can't even really do it justice.
It's gross. The students do say, okay, it's a snake bite. How do we find out what antivenom to give the guy if they don't know what kind of snake it is? House then says he has, quote, people who can find these things out. We then find Doctors Chase and Foreman, House's underlings, have been sent to find out the hissing culprit. They are met with a bit of trouble, though, a very rambunctious dog at the farm. This will take a bit, so House shifts to the volleyball player. In the flashback, we see JJ once again in his volleyball short shorts, and Dr. Cameron, another House underling, is examining his leg. Kids start to toss some questions out like, how old's this patient really? And House starts questioning some moral things like, hey, would you work on your mother? No, then why are you so eager to treat every patient like their family?
Yeah, you must. House's message always seems to be operate with a level of detachment.
Mm-hmm. These are patients. They're not your friend. They're not your family.
And make sure that they know that they're not your friend or family. Be it completely mean and just make them feel sad and uncomfortable.
So what happens when you treat patients like their family? Here's what happens. And we find a flashback with Dr. Cameron explaining a whole bunch of teen girl stuff to House as she explains what Cameron thinks is wrong with the volleyball player.
She's talking about like BTS or whatever.
Your boyfriend's mean or something. Yeah, it's young girl stuff. Dr. Cameron, through getting too into the case, found a lymph node nodule, which then requires the hospital to put the girl through, as House says, an expensive and painful test, which may not be necessary at all. They think she just has tinnitus in her leg.
Yeah. Oh, tendinitis.
Tendinitis.
Which, by the way, push my glasses up on the bridge of my nose. They are brainstorming issues for this patient in the flashback scene, and there's a whiteboard behind House who is presumably helming it and writing down the things that everyone's suggesting could be what's wrong with the girl. And they write tendinitis on there and they spell it wrong.
Did they really?
Which is, I thought was very strange for a medical show. But it's the way that it should be spelled.
Yeah.
Which is like tendonitis. But in reality,
right?
it's spelled with an I.
Oh, an I, okay.
Tendinitis. Or
Interesting.
tendinitis, rather. So, yep, that's something I noticed, and I'll see myself out.
Well, I was going to say, like, Dr. House doesn't care about spelling, but he's absolutely, they paint him to be so smart that he would know it.
Yeah, he would not spell
everything.
that.
Now, back on the third case, after more Carmen Electra gags, House reveals it was a middle-aged man screaming uncontrollably about leg pain. He is losing it about this pain, and the students are bickering about what to do. They seem to think this is the guy who's faking for painkillers, and they do not want to give him any. The man snatches a needle out of House's hand and injects himself with the painkillers, finally calming down. The students are all saying they screwed up, they enabled this guy. House implies giving him the painkillers was actually the right thing to do. And yeah, you're going to see plenty of drug chasing as a doctor because it works. It's just something you have to deal with the job. And House, as often is the case, I mean, he's a painkiller addict, says if people are in pain, give them the stuff that helps stop the pain. If they're chasing it, that's pretty much on them. We're not going to give them a 9-month supply. But in the moment, if they look like they're in pain, it's better treating someone who's hurt.
And then you work from there. And then at first, it was kind of jarring for me to see the patient jam a needle straight into his body. I will admit it makes more sense later.
Yeah, it does once we find out a few more tidbits of information. We next find Chase and Foreman on the phone, having found the snake which bit the farmer. It's a timber rattlesnake, which is one of the most venomous snakes in North America, by the way.
One of them Jersey rattlesnakes all wandering around, biting me on my New Jersey ranch.
They got that big bite out of here.
We got off pretty easy as far as poisonous snakes go in this area. Like, I mean,
it's copperhead, right?
It's in the entirety of America. We just don't have that many. Mm-hmm. There's only a few. I think it's like 3 in the entire continent.
Copperhead.
Some of the real awful ones are
Pliskin.
Australia. They have a lot of horrible things. We're pretty lucky. I'm not that worried about snakes, but some people probably should be.
I like snakes. I used to chase them and catch them out in the field across from my mom's house.
You caught them? What'd you do with them?
I just played them for a little bit. I just devoured them right there.
You know what? I am much less freaked out by snakes than spiders.
Spiders are your thing.
Yeah, I don't like them.
And it's
that's fair because you're not going to get like snakes just kind of invading your house all the time.
No, the snakes only come into my house when invited, kind of like Dracula's.
Yeah. Much like in House when he discusses the vampires. I wish there was a Vampire House episode. You guys talking about snakes made me think of Snakes on a Plane. There's that one scene where snakes have been destroying the plane for presumably 20 minutes at this time.
Yeah.
They come from somewhere, and someone in the background goes, "Snakes!"
Yeah, that is great. Also, that one guy gets bit in the penis by a snake.
Yeah, he sure does.
And I think that his reaction is just to announce that.
I think he also says, oh, no, it's the different guy who says, "Who's your daddy now, bitch?" And he puts the snake in the microwave. What a movie. What a movie that was.
There's a lot going on there.
At the hospital, Cameron prepares to give the farmer a dose of the anti-venom, and when she does, he starts having a horrible reaction. He struggles to breathe, his heart stops, cuts back to House at the classroom, and he says, "Hey, good time to go take a pee, right? We've got this up moment, this
He's
dramatic
loving this
moment."
At this point. This is something he was born to do, I guess, is just leave all these students on the edge of their seat. What a great guest instructor to have, too. You're just in this medical, and I don't know if I mean that actually. I think that's he seems like a horrible guy to have to deal with for a day. But he really did. This is an intense training class that he's giving him. It's like, I don't think I can get on your level with your wild passion for the job and how he delivers it in this very, let's go between cases and things like that. That would be like, you'd go home as that college kid and be like, holy shit, that was a little bit of an interesting day at school I had today.
The guest professor sure was a talented orator with the ability to weave between multiple narratives.
Can you imagine if you're like, okay, I got to go to class today. Oh, we have a substitute teacher, Dr. House, not knowing anything about it, but just seeing the name Dr. House. I mean, like, what the fuck is this House going to talk to me? This is weird.
I would expect a cartoon home that then spat out medical facts in song form. This, by the way, this also is kind of like we're sort of surrogates for the classroom at this point, and he's basically like, everybody take a pee break. And this whole thing has proved Cuddy right when she makes that little joke like, hey, you'd probably like to hear yourself talk for a couple hours.
Yeah, once he gets started, he definitely does. You
Yeah.
can tell he's all about it.
He's a narcissist through and through.
Right.
Yeah.
100%.
He bitches about it, but as soon as he starts, he's like, yeah, I'm gonna make this everything I can.
But that's one of the small traits that endears House to me, because I'm the same way. People are like, oh, do you want to go party or do you want to hang out or something? Like, God, no, that sounds awful.
And then once
when I
you're
get there and
there,
do it, I have
yeah.
a blast.
Yeah.
It's just the motivation part.
Yeah, I'm with you on
That's
that.
an
There's a lot
introvert
of
thing for sure. Yeah.
Yes.
Once you do it, you're fine. But
Mhm.
the thought of it, ugh.
like, oh, I'm in my chair.
And did you take a pee break when he announced it, Brian? Where you're like, okay, this is perfect.
I'm not even kidding. Yes, I had to pee for a little bit going in, and I just hadn't. So actually,
If somebody tells
House
me to
told
pee, I'm gonna pee.
That's
I
might as
especially
well.
House. He's very authoritative.
He's a doctor.
Next, we find House in the hall chatting with his only friend in life, oncologist Dr. Wilson. I love Dr. Wilson. He's so mean to House sometimes while also
Especially
being
like
sweet.
when he peeks over the fence into your yard to talk
Yeah,
to
gives
you.
advice. It's great.
Yeah.
He has his bucket hat
Yeah.
on. Presumably his wife's dead. I don't know why he's here by
Sometimes
himself.
he's a volleyball.
These two are talking about Stacy and her new husband, and Wilson explains to House that she came to him for help because she needs it. She doesn't hate House. She just doesn't like him very much, which, a lot of people, I think, feel the same way about House.
Oh, I hate him.
The students get angry. They poke their heads out, and they're like, yeah, it's been 6 minutes on break, Dr. House. Perchance we should get back to the lesson.
That aggravated me so much. There are several students like that, and there's this idea that there's a pervasive thought that we need to get back to it. Come on, guys.
They got to be doctors as soon as possible.
And
That's right.
I was thinking no classroom would ever be this way, and then I remembered I've definitely never been a medical student.
Yeah.
For all I know, those people are total nerds.
The sooner they finish this class, the sooner they can put on their very own stethoscope.
If any medical students are listening, please let us know if you would be this much of a dork.
And like you guys said, I mean, this class is awesome.
Yeah.
This great story being
I
told.
mean, it is fun unless you get called on.
Yeah, then he's mean.
And then you get berated
Mouth
and maybe
buzzard.
start questioning your life choices.
Upon returning to the class, House mentions that the volleyball player is responding great to the anti-inflammatories, but that her T4 count came back low, which means that she does, in fact, have a thyroid condition, which is what Dr. Cameron initially thought.
Yeah, T4, it's one of the things in the TSH test, the thyroid stimulating hormone test.
Very good, Brian. I'm proud that you know this. How did you cheat and look it up? Because I know this from my practice.
No, I know this from my job of dealing with medical records.
That's right, yeah. So the students get all huffy. They're mad that House was so down on Cameron getting too into this case, because in this scenario, it paid off. House does agree, says it did pay off, but once again, his first point is Cameron put someone through very painful and expensive tests that were not warranted by the situation.
You would think House would like administering pain to others, though.
He does, and we get into that in just
Yeah.
a
I
moment,
think he
too.
would just rather rebuke someone for doing something wrong. Is like that's his whole thing. It's like, oh, you fucking idiot, you messed up again.
That's a good point. He's humane when it comes to
Children in
physicality,
particular,
but
too.
not like when it comes to words, which...
Right.
No,
you
he
know what,
wants
those
to hurt you
too.
as much as he can emotionally.
Well, House says, damn, this is boring. Let's talk about the farmer again.
Let's switch around.
He kind of concedes to the class that the snakebite farmer is the most interesting of his patients.
At this point.
At this point.
Now, next we see a horrible flesh wound. It's on the leg of the farmer, and it is super fucking gross. And House even says so. He's like, it's kind of gross.
Yeah.
Turns out they managed to stabilize the guy, but after everything, he's still deteriorating. House and his lackeys are seen explaining what's going on in House's very dark office. And this is a staple of the series. The crew usually gets together at least once an episode. They'll spitball ideas. House will make fun of them. And then they get a plan. They think, okay, let's test for this, this, and this. And then
I've got to think that was kind of what they didn't want to focus too much on the white coats in the hallway, so they do these extensive office scenes where they talk about the patients there instead of focusing more on like how the hospital's running overall, like they do in Scrubs, for instance.
Yeah.
Fewer walk and talks, more stand in a room and
much
talks.
much more just doctors in a room being like, I don't know, I don't think you're right about that diagnosis. That's like that's a lot of the premise of this show.
Well, part of the problem, too, with walk and talks is that your core cast member character can't walk. So that makes it
Yeah.
slightly more difficult.
You would have to be
Yeah.
limping the whole time.
They do start by questioning if the snake wrangler got the type of snake wrong, But Foreman points out that they received a fax analyzing the venom from the snake, and it does match a timber rattlesnake. House takes a look at this sheet, and of course he's a snake venom expert too.
Why not? Why wouldn't he be?
He watched the Snake Week on the Discovery Channel or whatever.
That's a pretty great week. He does realize there's way too much venom still in the snake, which would be out of the ordinary because it should have all been released when it bit the farmer. In particular, by the way, this type of snake, when it bites, it releases a lot of venom.
Well,
It's a
did you
trait
know
of
that
the species.
only I think it's only like 75% of their 50 to 75% of the bites that snakes have are actually venomous.
Really?
They don't always
Huh.
release it.
Interesting.
Sometimes they'll just bite you, even a venomous one. And then sometimes, depending on the threat, they put it in there.
Sometimes they shoot blanks.
Well,
Yeah,
snakes are
they
not
feel like it's
evil,
not
guys.
necessary.
Exactly.
They're not, yeah.
They're just
No.
afraid at that point.
Yeah, okay. Nagini, not the best snake.
Also, not a snake.
well,
it's an
yeah.
Asian girl if you watch the new ones.
So I think what we're getting onto here is that snakes are the good guy.
They are a good guy.
Yeah.
They belonged on that plane.
Look, just because they're supposed
They
to...
should have taken over the plane and flown it to somewhere where they're happy.
I get it. No hands, no feet. They're weird with S's, and they have little forked tongues, and they've been depicted to represent Satan
Yeah,
throughout
forever.
creative works in history,
Forever.
but let's not judge them that way. Let's pick up our snake neighbors, maybe give them a
I'm
little
glad that
hug.
was the main takeaway from this house episode.
We love snakes here. Yeah. Do you guys remember the 3 types of snakes that they have in New Jersey? I have the list here.
No.
There's the timber rattlesnake, which we discussed,
Wawa.
the copperhead,
That's in New Jersey?
and then the solid snake is the third one. And he's like, Otacon, I have to bite this guy. This farmer's in my way. Dun, 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 dun. No,
And
the
then he does.
coral
He
snake.
stealthily bites
He does.
his nemesis.
He puts his venom in there. Liquid!
Okay, on that note, let's take a quick break so I can use the facilities myself, and then we'll get back and continue talking about this episode of House.
Back in the classroom, one student says, hey, we should give him the third snake's antivenom. Another student says, we can't just give him the third antivenom blindly. House essentially says, what should we do? We need to figure something out. The guy's dying. We don't have time. He's mean to the students, but he's like, look, when you have a patient there dying in front of you, it's more stressful than an angry handicapped guy screaming at you.
And I think, though, that's actually, like, this is an excuse for House to just be mean to people. He's like, no, you don't understand, you piece of shit. This is what it would be like if you had a
Yes.
real patient.
Right. In this case, though, it's kind of like I kind of understand what he's doing, where he's trying to be like,
Yeah.
this is a classroom setting, but you need to be ready to think on your feet. You can't just talk it out all the time. People's
Yeah.
lives are at risk. So
I
in that case, it was
definitely-
like, yeah, House has got a point.
I get what he's doing, but it's
you don't
hard.
like how he did it.
It's hard for me to separate anything from
It's hard-
45-year-old man yelling at 18-year-olds.
It's hard to separate House from your dad.
Yeah.
That's what you're getting at
Yeah,
there.
exactly. And my dad was shitty at walking, too.
And House says, when he referred to those 3 species of snakes, he said they're the common snakes found in New Jersey. So one of the students very smartly says, what about the uncommon snakes? We should go look for it so we can get the
Oh.
right antivenom. And he's like, oh, great, go for it. When you get back, he'll be dead. You
Yeah.
just don't have the time to do it.
That's, again, House's punchline is they'll be dead.
Yes. Now, he reveals that, in fact, they did give him the third antivenom, and we see it. Nothing happens. Everything seems fine. So House waddles away and is interrupted by patient C. This is flashback time, by the way. The one who injected himself with the pain meds.
No, it's our boring drug addict, right?
He's back, and he says, hey, the pain's back. So the students all still simply believed he's a drug addict. And at this point, House reveals what he does to people he thinks are scamming for drugs. We mentioned being physically mean to people. Here, he's physically mean. More on this, too, because I have some questions when we get to the end of the episode. He gives them a urine test. Except by urine test, he means he's going to shove a tube up their urethra and extract urine in the most painful way possible.
Yeah, if you want these drugs, you got to earn it
He says,
through your
look,
penis.
if you can handle a rubber hose up your dick for a half hour, you must be hurt. You get drugs.
Yeah.
Good for you.
Yeah.
Yeah. Ugh.
Now, in an unexpected twist, we are back at the volleyball player's side. They're taking blood from her, and she is freaking out. She's in immense pain, even with a simple blood draw. House and crew try to figure out why, and they debate some options. He assigns some tests, and we get a reveal that these 3 stories are not happening concurrently. To this point, we think, oh, he just has 3 patients at the same time. No, we don't know the time difference. We just know they're not happening at the exact same time. There's a bit about time not being a fixed construct, which I kind of enjoyed. And then we're giving our
Of
first...
course, that's what you're going to get in a House episode.
That's right. And we're giving our first real clue that there's something amiss about these 3 stories. Something's not quite right. House is
Not all
keeping
adding
something
up,
back.
is it? And not just the Carmen Electra ogling part.
Yeah, not even just the parts he just admitted to. We get an update on the farmer. He's dying. And that's because they administered the anti-venom too late. They think there's just nothing we can do. Turns out that despite the farmer saying his wife is, quote, on the way, he doesn't actually have a wife.
Yeah, he's just full of shit all the way around, this guy is.
So something's amiss with him, too.
A little bit.
I don't know about that guy.
Then we get an update once again on patient C, who has the tube up his penis, and he's currently peeing blood into the bag or whatever that's
Yeah, it's
coming
like
out of.
rust-colored urine.
There's a bit here with House philosophizing about telling someone that they are dying. He's talking about a coworker who has to give him $10 every time a patient thanks him when he tells them they're dying. The coworker, not House, of course. He's that good. This is Dr. Wilson, just so you know. As the oncologist, the friend.
Oh, yeah, the only person he'd be friendly enough to have such a wager with.
He goes to cancer patients more often than not. We see him do this a lot of times.
Oh, because
he's a nice
an
guy.
oncologist, too, so... I mean, that's kind of not fair. He's getting a lot of plate appearances, so to speak.
That's true. Now, this leads into House telling the farmer he's dying. The only thing the farmer seems remotely concerned about, though, is his dog. The students catch on to this, and they're like, what the fuck? Guy's dying, and the only thing he cares about is his dog? House says there's a basic truth to the human condition. Everyone lies. Which, by the way, is the tagline for the show. Everybody
Everyone
lies. That's what they say. That's what it's based on.
Yeah, it's got a good worldview.
Yeah. The difference between people just simply is what are they willing to lie for or about. House manages to Sherlock his way into realizing that this was not, in fact, a snake bite. This was a dog bite.
Oh, shit.
Which he really confronts him pretty quickly, abruptly about that. He's like, wasn't a snake bite at all, was it?
Mhm.
The way he hammers him with that in the room.
And
Who's your
he's like,
daughter?
it was solid snake, wasn't it? Turns out the farmer's dog bit a neighbor recently, and apparently in New Jersey, or at least fake New Jersey. If that happens again, they put the dog down.
We got a 2-bite rule here in Jersey. 1 bite, that's on us for letting you get so close. 2 bites, bullet between the eyes.
There's this cool deli up by my house. It's also got a 2-bite rule. You got to bite the sandwich 2 times and finish it. Otherwise, you're kicked out. The guy realized this, of course, and lied his way through this whole ordeal trying to save his dog. Chase and Foreman are back on the farm trying to get a saliva sample from this, quote, vicious dog.
Ugh, if I had $1.
And this pretty much closes the book on this case. There's a little bit more that comes on. Now, through a coloring experiment, House reveals that patient C with the blood in the urine also has feces in his urine, meaning his kidneys are shutting down. He grills the students on what to do, being mean as usual, and at one point calls a student useless, but at least you know it.
I think, yeah, doesn't he say that to a couple of different students?
Well, then the next one who's like, oh, no, we just need to do this, 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 and House gets mad and he says, you know what's worse than being useless? It's being useless and oblivious. Like, he's just so
He's
mean.
just tearing these kids apart at this point.
Almost like he has a vested interest in this story.
It's almost
Weird.
like this case particular has a home in his heart.
Now, one thing I did not mention yet throughout this whole thing is that more and more people are finding their way into the class. Every time we
I
pan
was
back,
so
it's getting
confused
bigger.
about that. I was like, is this some sort of dream sequence? Like, why is everybody showing up here?
Look, if a troupe of actors was putting on Shakespeare in the Park, people are going to gather.
Yeah,
So
there's
here
like
they
an
gather at
underground
House.
Pixies
And
show in
they're all-
1986. And people hear about it. They start showing up. Yeah, so a pitcher's throwing a no-hitter. More fans are going to come in and pay attention.
The great thing about that, though, is that they're all pitching in. They're all talking
Yeah.
about, they're all throwing in their thing.
Yeah.
Random doctors are coming in like, oh, what if it's a cold?
I'm telling you, this class that these medical students were in, they're going to be like, what the fuck? What am I doing here?
Yeah, the next day the regular professor's going to be back and they're just going to be like, open your books.
There's going to be like an extra 50 people in the
Yeah.
class. At this point, House is pretty agitated. He's yelling to the students to try and figure out what the hell to do here when Dr. Cameron makes her way to the room and suggests the thing that they're missing is muscle death. House gets real snippy with her, and she says, look, there's no shame in a doctor consult. He's like, you're not playing by the rules. Why? You can ask doctors anything at any time.
Yeah.
That's what she's essentially telling the students.
Is use your resources, which are the people around you.
Mm-hmm. Now, we find out that it took a full 3 days before anyone suggested muscle death with this patient. But there's a caveat. It was not one of the guy's doctors that suggested that. It was the patient.
Oh, I wonder why.
The same patient
Yeah.
that knew how to plunge a syringe directly into his own body earlier?
That's right. So this guy's either super versed in medical issues, or he just might be a doctor himself.
Huh.
Both.
Might have been me.
Could have been.
Ooh, but you say there's been muscle death,
Don't look at my legs.
and he has leg pain.
Yeah.
Huh. Do we know any doctors?
I don't understand where you're getting at.
Yeah, I
Please
don't
explain.
either. I keep telling us about the episode.
All right, very well. The volleyball player has undergone, according to my notes, undergone an MRI, and it turns out she has a cancerous tumor in her femur
Oh, no.
and
It's not good.
osteosarcoma, for
Mm.
those wondering. Dr. Cameron kind of explains this to the girl and her parents, and she warns them that, look, depending on the size of the tumor, the surgeon might need to amputate the girl's leg. She's going to be perfectly fine with chemo, but losing her leg is obviously a big deal. The screen transitions to Dr. Foreman telling the farmer he too might end up losing his leg, but he's going to be okay now that they know what to treat. And finally, we get another fade, and we find Dr. Cuddy telling patient C that the MRI revealed a problem with his leg. She apologizes for her doctor's failures and reassures the patient she's going to oversee his treatment from here on out. Unfortunately, though, there's a chance that they need to remove his leg as well. All 3 patients are revealed to potentially have to lose
We
their
might have
That is a tough time.
We might have a trio of amputations going on here in this episode.
The only
Indeed.
one who I'd imagine might be like, okay, would be the dog bite victim, as he was told he was going to die
Yeah.
just before
He would
This is
die
an
for his
improvement.
dog, so why not lose your leg for your dog?
Yeah.
Yeah.
That's nothing.
Now, back in the classroom, House says patient C's pain wasn't caused by self-injection or an infection, but that it was an aneurysm that clotted, which led to an infarction. Upon saying this, we realize all of House's crew is here in the class listening in, and Dr. Foreman leans over to, I believe, Dr. Cameron and says, "You're right. It's House."
Oh, he's been talking about his own case and what happened to his leg this whole time.
Wow. Well, we're learning exactly what happened with his leg. Again, this is a big deal on the show.
Yeah.
Now that we know that this is
Yeah.
what's going
I
on.
bet if you were an active House fan at the time, you would be
Must
just
have been
glued
huge,
to
yeah.
the screen.
I don't think he should have gotten that personal with the students. I just don't think he should have gone to that case. He
I
really
wonder
seemed
what made him.
I think he was doing some sort of self-therapy session there. Like
he was, because he was thinking about
he
this
was trying to
because
work
of the girlfriend.
through. Yes, he was trying to work
Oh,
through
yeah?
that thing. But like, should we really use 18-year-olds for that, or 20-year-olds, whatever? Should we? Let's let me talk through my inner demons with you, innocent children. Here is basically the premise of
Yeah,
that.
and usually if you're asking a question that starts with, should we use 18-year-olds?
Probably not.
Probably
Easy answer.
err on the side of no.
So now, for the rest of the episode, whenever we see the flashbacks happen, it's House. Patient C is House. Stacy is here as his girlfriend, and we find Cuddy telling him that they absolutely have to do this surgery. House is steadfast that in no way are they going to cut off his leg because they want to amputate right away. No question. Let's amputate. Get it out.
Yeah.
Would you guys rather have House's limp or lose your leg?
Limp.
You gave me the limp, I think.
I
yeah.
agree. I put in my notes, which my phone ate afterwards, that I am not strong enough to take an amputation of any kind. Like I just feel like that would kill me too much emotionally. So I felt I had a lot of sympathy for House in that situation where he said, you know, I think, and especially since he's a doctor, and as are you, Van, and he just kind of felt like I want to tough this out and keep the leg. I want to do it that way. I would have probably said the same thing. It's like, if I have to lose my leg, probably go ahead and just let me die.
I sit so much of the time anyway. Like, I would let them take the leg versus my death, but I would hold out as long as I could.
But what if the limp happened afterwards? You'd be stuck with it. You're taking that chance, and you said you didn't want the limp.
No, I said I would take the limp.
Oh,
I mean,
sorry.
you'd have a limp regardless because you would have
Yeah.
the prosthetic
You-
at best.
So, okay, I'm sorry. Let me rephrase my question then. Would you
If it's versus death, I'll take the other thing, I
you would
guess.
rather have your leg taken off
Yeah.
than die?
Yeah.
Yeah. I think just go ahead and kill me. Everyone's going to be judging you every single step you take, just like that Police song.
That's what it was about. It was about Dr. House.
Every step you take
Yeah.
was actually
Every
what it
hobble
was
you
called,
took.
for sure.
Every step you sort of take.
Okay, let's do this then. I'm going to give you 2 scenarios.
Okay.
Oh, good.
Hearing or vision? Which would you rather lose?
Absolutely vision. Get rid of my vision.
We've talked about that before, actually. So yeah, no, I need to see. I need to see.
I'm with Spencer. It's vision. I already can't hear anything anyway.
Yeah,
So.
But
You're a music guy.
As a music person, but also like,
You wouldn't really be able to do much musically, though. You wouldn't be able to see what you were doing.
I don't really look that much anyway.
Obviously, you could play. Most people who are good.
You wouldn't be able to.
That
do
sounds
your
like
own...
I'm criticizing Brian, by the way. Most people who are actually good don't look at their stuff when they play. I mean, you can,
Sure.
but
No, that's
Yeah,
fair.
and-
You would have to have everyone record everything for you because you sure as
Also,
shit couldn't
let's
see your
all,
screen.
let's all have a talking competition after you guys lose your hearing and see who does the best.
what? Huh? Okay. Arm or leg? Which would you rather lose?
Leg.
That's really tough.
I feel like I can still do most of what I do with the upper body. My athletic days
Well,
never existed.
are we talking
/
about-
are gone.
Are we talking about prosthetics involved?
Well, I
'Cause
mean,
it's
yes,
pretty
but you're
easy.
not going to get the Metal Gear Solid.
No, I get
arm,
that. I
but-
actually think it would
Oh,
be
man.
easier to
That
replace a
changes the
leg
game.
than because of all the finger movement.
Yeah,
Yeah.
exactly.
So I think
Hands
I
are-
would go with leg as well.
Hands
I'd
are a
rather-
big part of
Yeah.
human stuff.
You know, you can't. And
Thumbs.
they're working on
Yeah.
that. They're working on that. I've heard they've got
Yeah.
some really good hand prosthetics now. But yeah, I think leg would be easier to replace. I do.
That's fascinating to me too, because you'll see people with like full arm amputations who they'll have those that are super expensive still things, and the twitch of the muscle in the shoulder that they still have can work one
actually,
finger.
Yeah, that is so
Blows my mind.
bonkers.
It's weird. Yeah.
Okay, let's get back
House
to this.
would know why.
He knows why.
Yeah.
When discussing the issue in the past, we get another exposition argument from two doctors, as the deal is this. This is Cuddy and House, of course. The lack of blood flow has caused tissue death, and the safest thing to do is to amputate the leg. House says instead he wants to do a bypass where they reroute the blood flow past the clot. But when you do that, he says that all the buildup and stuff from the stagnant limb will, instead of just being removed with the limb, instead get flushed back into his system, which could kill him. In addition to that, the pain would be nearly unbearable, not only for the rest of his life, maybe it wouldn't be quite as bad for the rest of his life, but it would be nearly unbearable at the first, to
What
the
if
point of
you're-
your body dying.
Really super tough and mean, though.
I mean, he is, so I guess we find out what happens. Cuddy actually argues and argues and argues, saying we have to do the leg. This is the safe thing to do. House said the decision is final. Go schedule the operating room. I understand the risks. You're not going to get sued if something goes wrong. We get a montage of House writing "not this leg" on his good leg, and Stacy also writing "not this leg" either, which I didn't get the point of that. So they're still gonna have to
I
work
thought-
on one leg,
I thought
right?
it was House saying that not either leg. I guess.
Yeah, that's
Oh,
what I
okay.
thought as well.
I
is
thought I
that-
saw her writing.
No,
on
I
his leg.
think she said not this leg, and he
Okay.
said not this leg and not that leg. He was
Oh, okay.
basically saying like
Yeah.
you're not taking either one of these things.
that
These
makes
are
a whole lot more
mine.
sense.
That's
Got
what
it.
I thought.
We also see both the farmer and the volleyball player under the knife, and we can hear the bone saw as they work on the farmer. Now, there's a cool ass CGI scene of some gunk going through a bloodstream, and then we find House out of surgery, just screaming in pain, demanding morphine.
Yeah.
Stacy says, "Look, we can't give you any more, but I'll go check with the doctors." She leaves the room, stops to talk with Dr. Cuddy. Cuddy reveals the pain is going to be immense for an undetermined amount of time,
Ugh.
and likely will be with him for his whole life. There's also a middle ground that they've kind of thought of. It's a compromise between what they did and amputation. House in his hospital bed sees his own potassium levels rising and convinces a nurse to give him medication to keep his heart from exploding.
Oh, this is a great thing here. This that where he actually gets his own report from the machine.
Yeah, he pulls it off the
As
thing,
he's
reads
about
it.
as he's about to go into cardiac arrest
Yeah.
and diagnoses himself.
He's sweating. He's like, "You got about 20 seconds. You got to give it to me." Or
And he's
something bad's
also
gonna
lying.
happen."
It was like 5 seconds.
Yeah, it didn't take long.
Almost immediately.
And she does give him the medicine because she freaks out. She's like, "I'm going to
I
get
could
yelled
get in
at."
trouble.
Yeah, but Dr. House is going to yell at you worse. I can tell you that.
Even in cardiac arrest.
Especially in cardiac arrest.
House goes into cardiac arrest, as we've mentioned, and by his own admission, he dies here.
Now he gets to be, which is so in line with his personality, he gets to be one of those fucking guys who's like, technically, I was dead for over a minute. I don't feel pain.
Yeah, your favorite kind of guy.
Ugh.
We get some white glow across the screen, and House finds himself standing in a field, watching JJ the farmer walk his fence line He hikes up his pants to adjust his fake leg. We see, he got out okay, lost a leg. But
He's
he has a
doing
fake
all
Good
right.
for
yeah.
him. Good for him. I hope his dog's okay too.
Well, there is a dog, but I don't know if it's the same one there.
Hopefully it's a less
Yeah, they should probably
vicious
put down
one.
that rabid beast. I'm just saying.
He then finds himself sitting in a gymnasium. He's watching the volleyball players return to the game. She's at full health, has 2 real legs.
Yeah.
I don't know how else to say that. Not fake legs, not peg legs.
That would have been great if she was playing volleyball on her
With a
peg
pirate
leg.
yes.
Like does this super high impossible jump from her peg.
Maybe spikes it with the peg leg.
That'd be good. We hear the pop of the paddles, and House is shocked back to life by Dr. Cuddy. Back in the classroom, we hear the voice of House's bud, Dr. Wilson, who's been listening to this, and he found his way to the class. And he says, he starts a religious discussion in which apparently everyone here is disgusted House is not a godly man.
This is weird to me because
I
these are
did
all
not
medical
understand
students.
the scene.
Yeah,
Yeah.
exactly.
There's no scenario where they're not all prevalently atheist, I would think.
And I have a clip for you guys, too, so you can hear what happens.
Do you think he was dead? Do you think those experiences were real?
Define real. They were real experiences. What they meant, personally, I choose to believe that the white light people sometimes see, visions this patient saw, they're all just chemical reactions that take place while the brain shuts down.
You choose to believe that?
There's no conclusive science. My choice has no practical relevance to my life. I choose the outcome I find more comforting.
You find it more comforting to believe that this is it?
I find it more comforting to believe that this isn't simply a test.
What he's saying
Yeah.
is the Bible people are saying God put you down here to show that you're a godly man and you have to do everything right. Otherwise, you don't get to go to heaven and have fun. House is saying that's bullshit. This is not just a test. This is all we have. Live it to the extreme. Do what you want. That's
YOLO.
what
I love
YOLO.
this house. I love this sentiment. Like, this life counts too.
And this
You
is
tell 'em,
a
House.
recurring thing throughout the show. It's always people like, oh, you should believe in Jesus. He makes good things happen. House is like, bad things happen nonstop. What are you talking about?
Yeah,
Anyway.
maybe if he were to get in touch with Hercules, Hercules could put him in touch with some fine films called God's Not Dead. And
Maybe.
God's Not Dead 2. And,
God's not dead, a light in darkness?
yes.
Okay, perfect. Now we see another discussion between House and Stacy in the past where she's trying to reason with him. He says, it's my leg, my life. She says, well, would you give up your leg to save my life? Of course, he responds. Then
No.
why do you think your life is worth less than mine? She also says, what would you do if this was any other patient? House kind of waffles and like, I'd tell them it's their decision. She's like, hell no, you wouldn't. You browbeat the shit out of these people because
Yeah.
they're being
Yeah.
unbelievably stupid.
And he would be. I also thought it was really interesting, and this is jumping ahead a little bit to our episode for later in the week, but in this house episode, he essentially is the guy who doesn't think his life is worth saving. And then in the next episode we watch, he decries the idea of a person who believes that their life isn't worth more than someone else's, saying that it's worthless and they might as well commit suicide.
Yeah.
So he changes a lot in these few seasons.
He grows a little bit.
Or, I don't know,
regresses, I
regresses,
guess I
I
would
think,
say.
yeah.
Just depends on the episode and what the plot is.
What they need him to be, I guess.
After this discussion, Stacy tells Cuddy House wants to be put in a medically induced coma to get through the worst part of the pain. She says, hey, what happens when he's in that coma? I'm his healthcare proxy. So if he's unable to make decisions, i.e. in a coma, I can make them for him, right? Cuddy's obviously not cool with this idea, but she's like, yep, that's kind of how it works. Now, in the hospital room, Cuddy's then seen putting the coma juice in the House's system. I don't know what it is. I just wanted to call it coma
I
juice.
think it's Orange High C.
Oh, that's it. That will put you in a coma. She says he'll be out in under a minute. As House drifts off to sleep, he says, I love you. Stacy apologizes. He's like, you don't have anything to be sorry for. And he passes out.
And he wakes up without his leg.
Pretty much. Not quite, but close. The second he's down for the count, Stacy brings up that middle ground option, which Cuddy reveals to be that they go in and cut out the dead muscle tissue as opposed to leaving in and letting it try to heal. This will save the leg, but remove some muscle mass and a lot of the pain. Stacy asks for the papers to sign to authorize it, and Cuddy says, oh, you're saving his life. But Stacy, with tears in her eyes, says he won't see it that way.
And he doesn't.
He doesn't. We are once again in the classroom, and House explains that because of the amount of tissue removed, the utility of the patient's leg, his leg, was severely compromised. Because of the time delay in their diagnosis, the patient continues to experience chronic pain. The classroom then debates the morality of the decision-making here, with some advocating it's the patient's call, others saying Stacy made the right decision.
And one of the students screams out from the back of the class, and if that person who made that decision later comes back into your life and wants you to help their husband, you shouldn't.
One student ends up saying that they did the right thing because the patient's an idiot, to which House replies, well, they usually are.
Probably true.
Self-burn.
Dr. Cuddy is in the classroom here now, and she reveals that the class was over 20 minutes ago. House gets up, and there's a whole subplot I didn't even touch on, which gets resolved here, and it's essentially, remember that teacher who House is subbing for? At one point, House found his coffee mug, which was clearly made by children, and it says World's Greatest Dad on it. House brings it over to Cuddy and says, who let their kids play with lead-based paint? Of course this guy's always sick. He's drinking lead paint out of this mug.
He solves the case just on accident, giving a lecture.
And also, he's probably not even ranked in the real World's Greatest Dad competition, so that mug's a lie. As House reflects and waddles to his office, he makes a phone call and gets a voicemail message or gets to the machine. He says, Stacy, it's Greg. I have a spot available tomorrow, so make sure your husband isn't late.
Oh man, he had to talk about his whole traumatic incident to make the right decision.
And it got him through it, and he realized, look, I need to help Greg. And he does. The next several episodes deal with that.
Oh,
I was
good.
actually going to ask if that pays off. If
I
that
think he
plot line
dies.
continues.
Not House, but the other
but
guy.
he tries. He tries to help him. Because, this at the start of this one, he's saying, I think I want him to die. So
Yeah.
good for him taking his own angst out on all these kids. And now he worked his way through to get to the right decision.
I know
Good for
the
him.
next episode begins with Cuddy and House at a restaurant waiting for, Stacy and House at the restaurant waiting for the husband.
Yeah.
And House is like, he's not going to show up. And she's like, he's just late. Finally, Stacy reveals, like, well, he's afraid of you. He'll be here. He's just afraid, so he has to build up to this.
I told him
I
how
can get
you're
that.
a total unrepentant asshole, and he, for some reason, is delaying showing up.
So there we go. That's the first episode of House. I have a couple of stray facts, but before we get into that, let's briefly discuss what you guys thought of the episode. Did you enjoy it? What did you think of this one?
I did, actually. I liked it. I was a little confused from all the flashbacks and from the doctors that continued to show up in the classroom. At some point, it took on a little bit of a surreal element to me. It was just kind of like, and plus how they did that big reveal at the end where it was House was the third patient. A lot of it I was watching, I was kind of thinking like, is this all like the narrator's projections here? What are we seeing? How much of this is actually real? How much of it is just House saying what he's saying? And I did have a difficult time following the thread of it, but I certainly was interested. And when I figured out the big reveal about his leg, that struck me as a big deal.
Mm-hmm. And it was. So it was not lost on you in that scenario.
No, I saw it was like, oh, they're explaining this entire thing. So it just took a while for that to dawn on me, that what they were doing there.
What's really funny is, while taking notes for the episode itself answered some of my questions, such as, who is this Stacy in relation to House's history? And also, hey, what happens to House's leg? Which is hilariously just a stray note I took down at the beginning to ask.
I didn't even wonder. I was like, he just has a limp. That's his thing.
I was going to ask in general to you about the show, Van, since you've seen a lot of it. But as it turns out, this episode is the one that tells you that. It was a very fun episode to watch. It breezed by, as is the case with episodes like this. Is it over the top a lot of the time? Of course it is.
Mm-hmm.
But yeah, it was a really, really smooth ride. I was taken aback a little bit by the fact that it had this gimmick, this 3-arc gimmick, and that's how House.
It's the German version of him. I'm a Dr.
That's how
Hausen.
House's backstory was revealed. I thought it was kind of strange to reveal it in such a gimmicky way.
And the element of a college class too. Yeah, it's just that's a very strange thing.
But I did get to thinking about it, and I guess you would have a lot of memories flooding back with Stacy arriving at your doorstep right before you're getting ready to go give some sort of lecture, which is apparently very unfocused.
Yeah.
He did it very well for not having any. He was
Notes?
just doing that off the cuff.
Yeah.
Yeah,
Yeah.
that's pretty. He was pretty
He had
entertaining.
it on his mind, apparently.
Yeah.
George R.R. Martin would have had to write this out for 10 years before he came up with it.
And then not publish it.
The question I wanted to ask you is, did you pick this because you wanted us to see the origin of his leg story?
Kind of. Well, let me explain. I have, again, watched all but the final season of House. So I've seen this one. This is regarded as one of the best episodes of House.
Oh.
It kind of deviates from the norm because it's not a case of the week thing. It's a whole different, as we
Yeah.
just discussed, story of figuring it out.
Cases of the week.
But it's still the same idea. He has to figure out this thing that is giving him loops. He has to weave his way in and out, test this, try that. It should be this, all the while dealing with the psychological aspects of it. I picked this one because it was so well rated, because it was an early season episode, which I wanted to do, and because it was actually a good one. And this kind of shows an example of how I can get lost in the show for 7+ seasons.
Oh, yeah.
It's fun, as Brian said. It's not the most highbrow, smartest thing ever, because they do have to exposition a lot of stuff
So
for
much.
the audience.
There
And
was
that
a
does
great
hurt,
there was
but-
a great scene early in the episode actually where I forget who he was talking to. I didn't notice, but when you first learn about his conundrum with having to help his ex-girlfriend with her significant other, and he says like I don't want to do that, and the guy like slips into the psychologist role on the fly. He's like, "You think this is easy for her? You think she would do this?" And that was a great line. That's basically like the episode being like, "Okay, we have to do this so you know what House is going through here." But this guy just does that while they're talking casually. Like, you know what? I think you should think about it from her point of view. Like, he would just do that, especially to an asshole like House. If that guy said anything to me, I'd be like, "Yep, sounds good. Yep."
Just leave.
Don't talk to me anymore. If I disagree with you, you're going to yell at me. So let's not talk.
This episode is also more kind of, despite it being one where they're revealing a big thing and breaking from the formula, it's more what I thought House was than the next one that we're going to discuss on the next episode. It's more
I don't
of
know
a
what that was.
medical mystery drama with
Yeah.
a few jokes thrown in rather than, well, something else entirely.
Yeah, I can't wait.
Okay, so when picking the second one, which again we'll discuss later in the week, let me get these episode titles out. You can watch House on Peacock. This is season 1, episode 21, 3 stories. The one we'll be watching later on the week is season 5, episode, I believe, 9, Last Resort. Has an armed gunman. If you're watching something with an armed gunman,
And
you're
that's
watching
not
the
even
right
a
one.
spoiler because you can see that right away in
It is
the
the screen
Peacock.
cap.
Yeah. They let you know what you're getting into.
I picked that one. Okay, here's what I did. When I decided I was doing House, I researched the best episodes, and I found this one, the one
I'm
we
sorry,
just
can I
watched.
stop you right there? And you said when I decided I was doing House. Like that. Let's just remember that forever. When I decided that I wanted to talk about House for a couple of hours.
This is what I did.
Which essentially is what you were deciding.
Yeah,
All
in
right, I'd
essence.
like to be involved a lot with House this week.
Well, I picked this episode for the reasons I said earlier. Then I turned on Peacock and I was like, I'm going to just find something. I watched like 4 or 5 episodes.
I don't doubt it.
And some were good. There was one with a guy who makes video games. His hands quit working.
Oh,
And
was
it's
it
a whole
carpal tunnel?
to-do.
I could diagose that.
I think it was a bacterial thing. I don't remember. But
No, it
anyway,
was carpal tunnel.
I watched a couple and I was like, I don't know. None of these are working for me. Wasn't there one where a guy held the hospital hostage? That's how I got to it. Because I was like, I know this one's crazy. It stood out to me. It was just strange. Sometimes they had very gimmicky episodes like that. I just thought it'd be fun to do, and it was.
Yeah, and
It
I
is.
wondered how common that was, the big time gimmicky episode.
Usually twice a season. And it's usually the cliffhanger episode is when something wacky happens.
Yeah.
I wonder how common the hostage situation was in the show.
6-7
once a
times.
season.
Yeah. Now, there's
Most
a
of 'em.
gimmick episode twice a season, but I will let you know, yeah, there are 6 or 7 armed gunman episodes per
Is
season.
that when House just puts on his SWAT uniform and he's actually an undercover SWAT agent or something? He's like, he's
Hobbling
ready
along.
for this shit.
Okay, a couple stray facts here. In total, House managed to win 2 Golden Globes,
Yay.
5 Primetime Emmys, a Teen Choice Award,
Ew.
and a Peabody Award.
Oh, I don't want that
Oh.
either.
I'm surprised it won a Teen Choice Award.
I wouldn't
For-
vote for that as a
Because
teenager.
Dr. House is so dreamy.
I've never seen Hugh Laurie on anybody's skate deck.
Well, I haven't either.
He should be. He should be.
We could make it happen.
I mentioned some musical guest stars. There were quite a few throughout the run of the series, including Dave Matthews, who was in this season and another episode, I believe.
Wow.
Patrick Stump, who's apparently a Fallout Boy. Whatever. Brandy, the singer, was on
Oh,
here.
yeah.
And of course, Meatloaf.
Well, he is at least an actor.
And kind of somewhat musically related to this, Lin-Manuel Miranda was actually in 2 episodes
Yeah.
as well. I liked
Hamilton
it.
himself.
That's right. He got shot and he's came his way over here to this show.
Good for him.
So that's going to do it for this episode of House. Like I said, we'll be back later in the week to discuss that
More
second
House.
episode. More House. It'll be very
We're
interesting.
going back inside the house.
Armed gunmen everywhere in this hospital.
Yeah, that's a crazy one.
You can, of course, find us on Twitter. I am at Manly Van Lee. Brian is at Loud Guitar Brian. And Spencer is at the number 3, French_hen. The show is at Boob Tube Boys. We have a website, which is boobtubeboys.com.
Uh-huh.
We have a Patreon, patreon.com/Bootu Inc., Bootu.
Bonus episodes every week.
That's right. If you join that, you'll get a bonus episode every week. This week, we drank some booze and we just talked some medical buffoonery.
Booze Tube Boys.
Ooh.
Also, I want to mention that I did link the Patreon to the website. So if it's easier for you to remember the boobtubeboys.com, you can find our Patreon through that website as well.
It's also really weird to search for that Patreon, too, I found out. So hopefully that'll get fixed soon. But anyway, check us out. We're really happy that you listen to our shows. We enjoy that you're enjoying this, and we'll continue doing some more. But for Brian and Spencer, I'm Van, and we'll be back later in the week with more Dr. House.
Bye.